Assembly member. I represent the 44th Assembly District, which is most of Ventura County, about 550,000 people. And we wanted to host this forum because one of the most significant number of phone calls we get to my office are questions about implementation of the Federal Affordable Care Act here in California called Covered California. Lots and lots of questions. It's a complicated body of law, and there has been some challenges with implementation. And certainly you can't pick up a newspaper today in this state or in any state and not read something about the Affordable Care Act. But what I wanted to do is have an opportunity for my constituents and the people that I represent, the families I represent in this region, to have an opportunity to get together and have a presentation by subject matter experts that hopefully will clarify some of the issues around Covered California. What does the law mean for you and your family? What are some of the deadlines? What are some of the implementation issues and implications of those deadlines? Those are some of the issues that we can bring up today, and some of the questions hopefully that we can answer. Again, I appreciate everyone being here today. I know that it's early. Feel free to get up and use the restroom. We've got some more coffee and water here. And then there's also subject matter experts in this room from different areas. We've got some folks in the back who are in the insurance industry and are subject matter experts to help answer some questions for you and your family. And you know, I don't need to say this, but there's a debate raging nationally about this policy body. Here in California and nationally, and particularly in Washington, D.C., this is not really the forum to debate that policy. That takes place at a different time and format to continue to debate the implementation of this policy. This is really to answer the technical questions for you and your family so that you can get coverage if you need it, and particularly those who currently don't have coverage and need to get health care protection for you and your family. I do want to make a couple of introductions. Our two first presenters are Catherine Pedrosa. She's from United Way of Ventura County. And then Nasim Badarani, who's also here. She's a public health coordinator for the county's Covered California Outreach and Education Grant. So we're going to turn it over to those two ladies, and we'll get started. Again, thank you very much. It's an honor to have you here today.
Yeah, we're just going to move the tables a little bit so that we can.
Yeah. Move the chairs out.
This way, right?
Well, just I figured so they can see the screen.
There you go. Yeah.
Hey, good morning. Thank you for being here. My name is Nasim Bahajarani. I'm the program coordinator for Public Health Outreach and Education Grants that they received from Southern California. So basically, we've gone through 2.5 days of training at Covered California, passed an exam of about 50 or so questions at 85%, in order to provide information, general information about what Covered California is, what the community can expect from it, and what it provides. So without further ado, I'll go into our presentation, and we will go through questions towards the end if that works for everybody. So we'll start off by asking if anyone has already insured, happens to be already insured by their job. Great. Now, do you know anyone who is uninsured?
Me.
Well, if the answer is yes, great. Keep your insurance. Now, if you're one of the 6 million people, such as myself, who had insurance, but received a letter from your healthcare provider saying that come January 1st, your coverage will be canceled. The reason is because our healthcare coverage coverage at the time did not meet Covered California standards. And those standards come in the form of 10 essential benefits, which we'll discuss in just a moment. So the state wants to make sure that you've got quality healthcare coverage. All right, so if the answer is no, you didn't have health insurance, if you know someone who doesn't, don't worry, we'll discuss what Covered California is today. Most reasons why people may not have health insurance is because they may either have been denied due to pre-existing conditions, maybe it was just simply unaffordable or not offered through their employer. Now, with Covered California, you've got improved coverage because there's guaranteed coverage at 1. There's no annual limits. There's no denial for pre-existing conditions. That's huge. Every time I say that, I kind of get goosebumps. Rates are not based on health status. And it's requiring large employers, meaning those who have 50 or more employees, to offer health coverage. It's also affordable coverage through private and public programs, and it's required for individuals. So what are these 10 essential benefits that provide these improved or quality care coverage? They include ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services. This also includes behavioral health treatment, prescription drugs, rehabilitative as well as habilitative services, laboratory services, preventive and wellness services, chronic disease management, and also pediatric services in the form of dental and vision. So who's eligible for Covered California? As long as you're a legal California resident. If you're an undocumented individual or currently incarcerated, then those individuals are not eligible for Covered California. Okay. Now, the vision of Covered California is to improve the health of all Californians by providing access to affordable care, by providing quality care. And the mission is to increase insured Californians, improve healthcare quality through lowering costs, reducing health disparities, and providing choice and value to the type of healthcare coverage you choose for yourself. Now, Covered California is operated by the state. It's one of the first state health exchange that's formed under the Affordable Care Act. And it's established as California's Health Benefit Exchange. It's one of 17 state-based marketplaces. Now, even though it's a .com website, it is state-run. And it does offer name brand health policies. What makes it affordable is that premiums are based on an income. Copays will not be a deterrent to healthcare. There's 0 deductibles for many plans. Free preventative care so that all wellness and preventative care services are free. And there's, of course, lower out-of-pocket maximums. Within Ventura County, the 3 healthcare plans available are actually Anthem, Blue Shield, and Kaiser Permanente. These are just names of different health insurance plans that are available, again, within Ventura County, Anthem, Blue Shield, and Kaiser Permanente. So besides Covered California offering healthcare coverage for individuals, they're also encouraging small business owners, meaning those who have less than 50 employees, to offer healthcare coverage for their employees. They do so by offering tax credits and providing choice plans for these employers. So what makes it affordable is that premiums are based on a sliding scale of one's income, not on your health status. 2.6 million Californians are eligible for subsidized care, in which they'll pay a portion of their income towards their premium, and the federal government pays that balance. There's standardized benefits, which are going to limit the out-of-pocket costs. Again, it's based on a sliding scale. And of course, most co-pays are not subject to deductible. And of course, we've got true transparency and the total maximum out-of-pocket cost that an individual pays. So you know upfront what the total cost will be for your healthcare coverage when you sign up for it.
Have you ever told a joke where the punchline was segmentation fault?
I wonder what the punchline is. Yeah, and then I'll lead into Catherine Pedrosa, who will go into examples of different types of premium assistance that's available.
Thank you, Nassim. Thank you, everybody, for attending today. I know there's a lot of questions. I was back there and I hopefully answered some questions already about Covered California and the coverage and problems with the website and all of that. This is, again, a general overview, and this is getting into kind of the substance of what Covered California can do for folks who are uninsured. So Nassim was saying that income is going to be important in determining how much you are going to be paying for your premiums for health insurance. It's going to be based on household size, so the number of people in your household is important, as well as your income. So you can see from this chart that for a household of one, so one person who's filing taxes on their own, if that person is making under $15,856, that person is eligible for Medi-Cal. If the person is making between $15,000 to about $45,000, then that person's eligible for some sort of subsidy through Covered California. And of course, the changes, the amount or income changes as the number of people in the household goes up. And people often ask, well, what determines household size? And that's going to be determined by how you file your taxes. So if you are a head of household and you're filing taxes, you have dependents, you count the number of dependents that you're claiming on your tax return, as well as if you're married, your spouse or significant other is also going to be part of that household. Can we hold the questions till the end? Okay, great. All right, so this is probably the most confusing part for a lot of folks about Covered California. This goes into choosing the health plan that's right for you. There are 4 metal tiers: bronze, silver, gold, and platinum. And each metal tier represents a percentage of cost that the health plan pays for and a percentage of cost that you, the consumer, pay for, okay? So with the bronze plan, 60% is covered by the health plan, 40% is covered by the consumer. Silver is 70-30, gold is 80-20, and platinum is 90-10. One of the questions I often get asked in these presentations is why would I choose a bronze plan if I could have a platinum plan, which is 90% of the cost covered by the health plan, right? So the difference in pricing is going to be whether you pay a higher premium, so you're a higher monthly payment, and a lower cost when you go to use healthcare services, that would be the platinum plan, or the bronze plan where you would pay less each month, right? Less of a monthly premium, but more of the out-of-pocket costs when you go to use healthcare. So the choice between a bronze, silver, gold, and platinum is going to be based on a lot of things, including what your lifestyle is, maybe how often you use healthcare, those types of personal decisions that go into, what type of health plan you're going to choose. But that really, this is a way to standardize healthcare choices, healthcare options for us. And so this hopefully gives you a general overview, and we certainly can go over in more detail as you choose to enroll. The Enrollment Council will go over in more detail with you how to make those choices and what goes into those choices. Forward. All right, so this gives you an example of the standard benefits. So with a couple of the plans Nassim already mentioned, there are deductibles. So with the bronze and the silver plan, there's a deductible. $5,000 with the bronze plan, $2,000 with the silver plan. And for those of you who are not familiar with the jargon of health insurance, the deductible is the amount that you pay out of pocket before the health insurance plan kicks in, okay? So $5,000 is a lot of money. And I often get asked, well, why would I choose a plan with a high deductible like $5,000? For folks who may not use a healthcare system a lot, They want that lower monthly premium, and unless they have a super, bad emergency or something terrible, medically terrible happens, then they are going to be prepared for that deductible. But there is the deductible for the bronze plan and for the silver plan. No deductible for gold or platinum, and you can see the difference in the primary care visit copays as well as the emergency room copays. One thing I want to point out that's really important is the maximum out-of-pocket amounts. So for an individual, for a household of one, the maximum out-of-pocket is $6,350. And that's important because that is the maximum amount that you will be paying out-of-pocket for your health care. So whereas in the past, that amount could have been $10,000, it could have been $8,000, whatever the amount was. Now it's standardized, so $6,350 is what you would pay out of pocket. So if you have, a medical emergency, if you have high medical costs this year because you have some unexpected medical costs coming in, you would be responsible for a total of $6,350, and the health insurance plan would be responsible for paying out the rest. Okay, that's really important because we know that more than half of all bankruptcies in this country are the result of medical bills. So that's an important number to keep in mind. For families, it's $12,700. Sorry. Just to go over, primary care visit copays for some of the plans are $45. And again, that maximum out of pocket. There's also a sliding scale benefit for the silver plan. So this is based, again, on your income. Some folks do qualify for this sliding scale for the silver plan, and this is the enhanced, we call it the enhanced silver plan. And it's enhanced because you can see based on your income, you're going to be paying less than what you normally would under the silver plan. So your monthly premium, as well as your deductibles, as well as your primary care co-pays, those are all going to come down. The amount is going to come down based on your income. So if you make between $17,000 to $22,000, for example, your deductible for a silver plan is only going to be $500, and your primary care visit co-pays are only going to be $15. So that makes it a little bit more affordable for people to actually access care. So we talked about what what the rates are based on. So they're no longer going to be based on any pre-existing conditions that you have. So whether you're diabetic or asthmatic, have any type of medical history, that's not going to factor into how much you pay. Your gender is not going to factor into how much you pay. It is going to be based on your age, where you live, your household size and income, as I mentioned, and the type of health plan and benefit level that you select. So this is an example of one individual. His name's Oscar. He's 25 years old, and he is single. So he files taxes on his own. He's a household of one. His annual income is $22,000, and he lives in Santa Barbara. Which I know I hear some of you say that how can you live in Santa Barbara? $22,000. Yes. Oscar's very nice parents who let him live with him. So Oscar is looking just at the silver plan. Because remember, there's 4 metal tiers, but we're just looking at the silver metal level. His premium, unsubsidized, is $249 under Blue Shield PPO plan. But because of his income, he gets premium assistance of $150. So his monthly premium payment is going to be $99 a month. If he chooses Anthem Blue Cross, he can pay $108 a month. So there is going to be some pricing differences among the different health plans. Okay, so Blue Shield, Blue Cross, and Anthem, they're all going to charge slightly different amounts. And whether you choose Blue Shield or Blue Cross or Kaiser, that's going to be personal choice based on maybe your doctor, the specific doctor you want to use, or the type of hospital that you want to go to. All of that's going to be based on those decisions. This is another example, the Taylor family. They also live in Santa Barbara. It's a family of 4, two adults and 2 children, and their annual income is $65,000. All right. So again, looking only at the silver metal level, their premium unsubsidized is $962 a month. Because of their income, they get a subsidy of $520, so their monthly payment is $443 under Blue Shield PPO. With Anthem Blue Cross, it's $477. So you can see the pricing difference among the two health plans listed here. But it's around the same, and the subsidy remains the same. Okay, it's not going to change. So what we do. This is coveredca.com. This is the website, and this is how most people will access enrollment into a Covered California plan. It is not a perfect website, but I've been using it, and it's pretty useful in that you can get all your questions answered. You can start the enrollment process on your own if you feel comfortable doing so, but you can also get information on where to get help. And there's a lot of different ways to get help. And in fact, there's a lot of different people in this room who can help you. So know that between the county, between United Way, and all the lovely insurance agents who are back there, there's a lot of people who are willing to help you and guide you through the process. So you're not alone. I just want to point out there is a toll-free number, the service center number, that's Covered California Service Center. I understand that the phone lines have been impacted, and as we approach our March 31st deadline, it's going to continue to be impacted. But there is that service center number, there's the website, and as I mentioned, all of the other what you will need when you enroll, you're going to need your social security number, you're going to need a W-2 or your income tax return for the prior year, and usually an ID card or some sort of resident identification. So these are the important dates. As I mentioned already, March 31st is the end of open enrollment into a Covered California plan. So it's a very, very busy time for us, and we're trying to get out the information as much as possible. In fact, if you know folks who are uninsured and they're not in the room here today, please take a brochure. Please let them know that March 31st is the deadline. And what that means is that you have to enroll into Covered California by March 31st. If you don't, then you cannot enroll into Covered California until the next open enrollment period, which is October through December of this year, so later this year. Okay? If you don't enroll into Covered California, you may be subject to the penalty. And the penalty in the next one? Oh, okay. I should talk about the penalty because there's probably a lot of questions around what the penalty is. So the penalty is first year, and it starts January 1st, right? Affordable Care Act provision. So if you don't have health insurance this year, when you go to file your taxes next year for 2014, the penalty is $95 or 1% of income, whichever is greater. For the second year out, it's $195 or 2% of income, whichever is greater. And for the third year out, it's 2.5% of income or $635, whichever is greater. There's additional penalties per dependent that is not insured as well. Call center times are 8 to 8, Monday through Friday, and they're also open on Saturdays as well. And there is language interpretation services available on the call center line. All right. So, who are... I'm almost done. Let me just get through this, and then we're going to open it up to questions, okay? So there are certified enrollment counselors and certified insurance agents. I am a certified enrollment counselor. I have a little badge, and it says Covered California on it. Certified insurance agents also should have either a badge or something saying that they are certified with Covered California, so that's really important. No badge? Okay, well then you guys... But you can say that you work for the state of Florida. You can say that you are certified through Covered California. And so you want to check and make sure that an insurance agent you're working with is certified through Covered California. And there's a lot of us and as well as insurance agents available in Ventura County. So if you go on the website, you can search by zip code where you live and find insurance agents and enrollment counselors who are in your area. All right, so again, our website, www.coveredca.com, the toll-free number, as well as all the local resources available to you. Now, I know we have a lot of questions. Should we take a few on Covered California?
Why don't you take your questions?
Okay,
Yeah.
okay. So between Nassim and myself, we're open to questions. And please remember that we're not with Covered California. We're really doing the education and outreach piece. So specific technical questions about your application, we can try and do some problem solving afterwards. But if you can hold those, and if you have more general questions, we would appreciate those. So I know I should start with you because
What happens with people who don't have insurance coverage because they got like I know people like myself, we got stuck in the process, and you don't have insurance coverage, and in the meantime you have a medical emergency that you need medical assistance or hospitalization. What happens?
when you say you're stuck in the process, what
Yeah.
does that mean? Did you try applying through Covered California?
Yeah, and I got stuck. They were
Okay.
asking for things that I didn't have handy or whatever, but
Okay.
my question is, what happens if you don't have insurance coverage, and in the meantime, you have a serious medical emergency that you need hospitalization?
Okay, that's a really good question. Again, that's a little bit technical in that it sounds like you're kind of in the middle of applying. So I don't know what the health plans or Covered California's policies are with regard to covering for care that was incurred while you were in the application process. I don't know if they say, no, you absolutely can't do that, or yes, we might cover some stuff. There's also emergency Medi-Cal for those who are uninsured. So there's a couple of different things, and that sounds like a pretty specific, depending upon what your situation is. So, we can talk a little bit about that afterwards and try and do some problem solving around that.
Yes, sir.
I'm already covered under California. I've worked in Europe, so I believe that universal health care is probably something we should have had years ago. There's a couple problems with Covered California that you should know about, because I signed up on the web. It's difficult to tell which plan you should have, and for that I would recommend see a planner or an insurance agent. The big problem I ran into is Blue Shield. My wife had some recent surgery. She went back in for a checkup. After she switched from a Blue Shield PPO Cobra plan to the Blue Shield under her. It's a whole different doctor's network. And I think Covered California is a bit disingenuous not to make that perfectly clear, because our doctors aren't in the plan. So that's a huge problem. And also, the State Department of Insurance covers one Blue Shield system, and of course the Department of Managed Health Care covers the other one. So someday that'll have to be resolved. Unfortunately, emails to Mr. Gorel went unanswered in this issue, so it's a problem people need to know about before they sign up.
Justin, you're field monitor for Covered California. Can you respond to this gentleman's concern in regards to the providers?
Well, are you asking, well, provider networks are different in the exchanges now. Anthem has their own network, Blue Shield has their own network. They are slimmed down quite a bit, and that is why you see the differentiation in the premiums.
Well, the problem was, of course, to me, Blue Shield's Blue Shield. They had one network.
But
Nobody
but
said
that's
there's two
not-
different networks.
Right, but that's not true. That wasn't even true before.
Well, it's
Because even in large group and smaller, I mean, you have different networks in Anthem too. I mean, you have the group buyer plan. I mean, you have
well,
different
that's
networks.
probably the counselor. That wasn't made clear on the site.
Right, and that's been a common, and I will tell you, that has been a common issue with
Yes.
everybody.
Yes.
Regardless of buying in Covered California or buying outside, if you're not subsidy eligible and you're just buying a plan, a full price plan, you still have the same networks. That part is not going away. So if you get a subsidy, don't feel like you're gonna get a smaller network than you would in Ventura County than if you bought a individual plan outside of Covered California. So don't think you're getting
Right.
like the raw end of the deal.
Thank you for bringing up the issue about the network, and I know a lot of people have questions and concerns about the provider networks. They may not be as robust as you like, and I know provider networks, health plans are trying to expand provider networks as much as possible. They're working hard to do that. In the meantime, if there's a provider you want to use, always check with the provider, check with the health plan. And I know in some cases, there's a lot of confusion about whether or not this provider is in the health plan, or you were told that this person is and is not anymore. If you run into those issues, know that there is a way to complain to the California Department of Managed Care. I think is that right? Yes. And you know, to let other people know as well that this is a real problem. And I understand I'm hearing it from more than one person, but there are ways to let people know that you're unhappy with that. But continue to work with your health plan, especially if you're already enrolled, and try and get a response that way as well. Okay, we have a lot of questions. I know you, Patrick.
Yes, to follow up on the Blue Shield, when I signed up in October, I actually called a Blue Shield agent. They said, yes, Los Robles hospitals could be covered. Everybody has to take it. Their only choice is to completely not take any Blue Shield plan or to take the colored pill. Well, that wasn't true. So now I'm on Blue Shield. Los Robles isn't covered. None of my doctors is covered. My question to you, can I switch if I find out that Los Robles will take Anthem and they won't take Blue Shield? Can I still switch to Anthem even though I've been on the plan now for 2.5 months?
You can make the change, yes. There's some things there I would need to ask in terms of Covered California, just you know, how frequently before open enrollment ends can you make that change? I don't think you need a circumstance to make that change. Insurance agents, right?
As long as it's before March 31st.
So you do, it sounds like you do have some time to make that switch. Sir.
For the term income, how's that defined for single people and families?
I'm sorry, can you repeat the question?
Income.
Oh, for income.
Is used throughout all literature.
Yes.
I only saw it defined on one of your slides there by an asterisk.
It's what you report on your income tax.
But what?
So it's, oh gosh, line 4, is it? It's your modified adjusted gross income, they call it. So it's the only as I'm going through the enrollment process, the only deductions they count are alimony and student loan interest, I believe, are 2 examples of any deductions that you can take from your income, your gross income.
Can you say that loud? We didn't hear that.
Oh, I apologize. I believe it's line 4 on your 1040, and I believe the deductions that they ask that you can take out are alimony and student loan interest. So I had a question about child support that was not eligible for a deduction.
What about self-employed?
That would go under the shop or the small business, small house entrepreneur.
No, we wouldn't. Self-employed would not buy.
Oh, yeah, for the shop operations, do you know, for small business,
There is a section in the enrollment process for self-employment. So there's your reported, and I think you have to kind of, I'm not as familiar with the self-employment piece, but there's a whole section that we would walk through in terms of what you would report.
So we may want to go into.
Yes. So maybe one more question, and then we're gonna move on, and then there'll be a little bit more time to answer questions. Okay?
Yes, Henry.
Yeah, when you have, because we have a lot of families that are 2 or 3 families now in the same house. So which income gets reported, or is it the whole household on the income? Or is it that family's taxes and this one's taxes? And because 3 families can report,
The entire house, it would be the entire household income.
Okay.
If I can also introduce at this time, Mr. Paul Bujald, going to.
Can everyone hear me without the mic on? No. All right, I use the mic. All right, I'm with the County of Ventura, the Human Services Agency, and we administer the Medi-Cal program. The Medi-Cal program is related with the Medi-Cal expansion to the Affordable Care Act. And so I'm going to just give you a little bit of background about the Medi-Cal program. There's 2 real groups in terms of Medi-Cal. There were adults and children. Previously, adults were largely excluded. They had to have a connection to a child. And so now single adults are eligible for the Medi-Cal program, and it kind of fits seamlessly. It provides a continuum of healthcare benefits based primarily on income. And so in the past, adults were covered, and it said previously ABD. That stands for aged, blind, and disabled, and I apologize for the jargon, but I've got everything on 2 lines that way. And so now almost everyone, including single adults, is eligible for Medi-Cal if they qualify based upon income. So the real question the Human Services Agency used to ask when we were looking at Medi-Cal applications is, if you're eligible, is really what you're eligible for. And we work closely with the Affordable Care Act. Some of the folks that come through our office are not, in fact, Medi-Cal eligible, but are, in fact, eligible for ACA. And then we can help them with those applications. And some folks that apply through Covered California are determined after being screened to be eligible for Medi-Cal, and then those applications find their way onto us. And so in Ventura County, just to give you kind of a context here, there are 135,000 uninsured people before under the age of 65. And that's not Medi-Cal only, that includes all the folks who do not have insurance for whatever reason. But again, that kind of gives you an idea. There's maybe, 850,000-ish people in the country. You want to just, I didn't know it was going to come up. This really represents the entire insurance landscape, and I'm talking about this spot here. I'm talking about the folks that make from 0 to 138% of the federal poverty level. Income's calculated basically the same way as we were talking earlier. Modified adjusted gross income as found on your tax form. And because the Medi-Cal program is in a transition, we have kind of two programs right now. We have MAGI and we have non-MAGI. Some of the traditional folks, for example, or they're in long-term care or have certain conditions will fit into our previous non-MAGI program, but I believe those are fading away. You can kind of see the writing on the wall that is part of this transition, that we are moving towards kind of a continuity of care. So what you're seeing is Medi-Cal covers this spectrum from 0 to 138% of FPL. We have some legacy programs here that continue to exist, but looks like they're going to be fading out. This is an older slide. At the time the slide was made, we weren't quite sure what was going to happen to 138% to 200% of FPL, but those folks actually go into the Affordable Care Act. These folks in here also in the Affordable Care Act, which is up to 400% of FPL. Above 400% of FPL, you can do whatever you like. You can get insurance from the private market. You can pick one of the plans on ACA. You still have the obligation to have insurance because the law is the law, but it just shows you kind of where you are in terms of the income spectrum. So when I say that, sorry, Ken. So when I say that we're creating a continuum of care, we really are. There's really not any gaps. There are some gaps for states that didn't accept the Medi-Cal expansion, but it's not relevant to California. That's a whole another. Okay, again, want to stress that almost all adults at or below 138% of the federal poverty level are now eligible. It's based primarily on income. Property and assets for adults used to be considered. So if you're thinking about the way Medi-Cal was for many, many years, we would look at your assets, we would look at your property. They're no longer considered for the program. We're also using electronic data to verify information such as your income and your citizenship. A number of the folks that apply through Medi-Cal now come down from Covered California, and we're hitting what we call the federal hub. But the information that you supply to us, whether you supply it online or whether you supply it through traditional means on paper, we go out to the federal hub and we will verify that. So we don't necessarily have to ask for all of the individuals to provide all the verifications. And it's an attempt to streamline and modernize the process. Back to the essential 10 health benefits. We didn't have a chance to coordinate presentations, so obviously I had a pretty good idea of what was going to be on their presentation, but we didn't put it together. I would like to just point out to a couple of things. Where is it? Mental health and substance abuse services. That's a new one, and that's a big one. And that really hits a lot of single adults in the lower income spectrum. Perhaps the reason they're in the lower income spectrum is because they have challenges in their life. Some of those challenges often revolve around mental health and substance abuse services. And we also have, they're on the same line. But so that's a big one. Just wanted to let people know that that is now available and it is now covered. Traditionally, it wasn't covered. And a lot of these folks would be going to, public health or the behavioral health clinic. Now they can find any type of provider who will accept services, and then they can go out and get those services. So I'm really excited about being able to provide that. What does 138% of FPL look like? Not much. And an individual making less than $16,000, and those numbers are rounded, it's like 15.8, or a family of 4 making less than $33,000. So if you're in that, if you're talking that in, I'm sorry, Kevin. If you're talking that type of income, then you're in the Medi-Cal spectrum. If your income is higher, then you're going to be in the covered California spectrum with subsidies or whatnot. Children a little bit different. When I talk about 138%, I'm really talking about adults. Children there was a program called the Healthy Families Program through Medi-Cal, which allowed children to have higher income limits, and that concept of children can still have higher income limits and be eligible is still true. So if you look at the age, depends on the age of the child, we break it out from 0 to 1, 1 to 6, and 6 to 19. And then so you can see where the TLICP, above 200 to 250, the child, if they're between 0 and 1, can still be on Medi-Cal. If they're 1 to 6, they can be up to 250. And again, 6 to 19, up to 250. So what that really means is that the children will pay a premium if you're above the income limits for 138%, but you're in between some of these areas. The children will fall into a program called TLICP. Now, I went super technical here, but what I do want to say is basically the income limits for children are higher. They will pay a premium. The premium is $13 a month per child, maximum of $39 per family. So it's still basically a screaming deal for the kids. It's very cheap. So depending on the kind of the net result of that is depending on income, children can be eligible for Medi-Cal, and the parents can be too high for Medi-Cal, so they can be eligible for Covered California. So we call those mixed households in our jargon, but the bottom line is that the parents can be on APTC, Covered California, and the children can be getting Medi-Cal. Medi-Cal is always a better deal in terms of cost, out-of-pocket, premiums, etc. Because of the 10 elements that all the plans have to provide, they're all going to provide basically the same elements of services. You don't have to worry about one plan being better than the other in terms of the services provided. For more information, you can go to coveredcalifornia.com. That's the state website. 1-800-300-1506. That's the number that you can call. This is our IVR or our. You forget stuff when you're standing in front of 100.
URLs.
Well, no, this is our phone number. It'll take you into our customer service center. So, and then finally, we have aggregated a lot of information under Covered BC. So the Ventura County has put together a website which just contains a lot of information, a lot of links, a lot of things you can read, places you can go, information about the insurance adjusters, information about Covered California, articles, information about us, pretty much whatever you might want to know. And also, there's a table in the back corner there, and I have a number of brochures. So obviously, we don't expect you to memorize this or to frantically write any of this down, but there are brochures that you can pick up that have all of this type of information. So that's really my presentation. And Guillermo, do you want me to answer Medi-Cal questions? Or we also have somebody from Gold Coast, and this is Guillermo Gonzalez, and we'll take questions at the end. Guillermo can basically say, after my Medi-Cal application has been approved, what happens? He can talk to you about provider networks, he can talk to you about the notices and messaging that you get, and a lot of the questions that I can answer are around eligibility and program rules and regulations. Guillermo is affiliated with Gold Coast, and Gold Coast is a managed care network that actually provides medical services for the Medi-Cal folks in Costa Rica.
Well, I guess at this point, we'll just open it up for questions. Like Paul said, my name is Guillermo Gonzalez, and I work as the Government Relations Director for the health plan. So, ask away. Yes, sir.
When the kids are in Medi-Cal, and let's say the income increases, the family income, at that point, the kids will join the parents into the covered CA. Does that change the premium or just affects the deductibles and things like that, now that the kids are part of the covered CA with the parents?
Yeah,
I would think it would if the child goes into Covered California.
Yeah, I can answer that question. When you have an increase in income significant, then you have to report that income. And then we would do another calculation based on the new income and then the household composition as determined by the tax filing household. So essentially what we do is we reevaluate based on that increase, and then you would, probably most likely have a higher premium. Again, Medi-Cal is the best deal that you can get. You're not going to do better in terms of cost-wise, because again, if you're talking about the people on the lowest income spectrum. In the back?
Yes, I have a question regarding the Medi-Cal Estate Recovery Program. I know that it currently applies to the ABD Medi-Cal. Does the Estate Recovery Program also apply to expanded?
You know, that's a really good question. We are hearing different things about the state. We've heard that the estate might be more aggressive in trying to do estate recovery, but we have not received an official letter. The human services agencies throughout all the counties receive letters from the state basically saying whenever there's a change in policy. So we are hearing chatter. We have not received a letter, so I can't tell you anything that has changed with the result because we have not received any official information. But I can tell you that this issue is being discussed, it's being reviewed based on kind of my experience and sort of hearing that chatter. But there's nothing that I could report to you that would be, that I could confidently say was accurate.
Okay. I just want to add a little bit to what Paul said. There are exemptions to the estate recovery. For instance, if the beneficiary has a surviving dependent, so there are exceptions. It's not, black and white that they're going to recover or take your house. There are exemptions to it.
Yeah. The surviving spouse and the children under 18, those exist right now. And again, those are the protections that are in place. So there's definitely protections in place, but we have not heard that the program will be changing or whether there will be more or less aggressively pursued up at the state level.
Yes.
Medi-Cal versus Covered California, do either of those, or are either of those solely PPO or HMO?
Well, for Medi-Cal, just like a managed care plan, like Blue Shield or any other plan, we have a closed network of doctors that we contract with, and you have to use those doctors within that network. Medi-Cal doesn't have a PPO.
So basically, if you live in Camarillo and you're on Medi-Cal, you have to go to Ventura Hospital. You can't go to Camarillo Hospital or Los Robles or something like that. The only hospital that you can go to is Ventura.
No, we have a network of hospitals within our network as well. We contract with all the major hospitals within Ventura County, and Los Robles is included in there.
Is Camarillo?
Is it Pleasant Valley?
Pleasant Valley.
Yes.
That's in there now
Yes.
too?
Yeah. Let's get somebody shot back there in the back.
Yeah, does the amount of money you have in a savings account affect your eligibility for Medi-Cal?
Not anymore.
You, sir, back there.
Kind of relevant to the question. So I actually used to work for the county, so I know a lot about Medi-Cal.
Be kind.
Yeah, used to. Anyway, so I guess my concern, because I don't have income right now, so I already applied for Medi-Cal. I have my own Kaiser coverage, which I'm losing March 9th, so I can't afford it. So my question is, do you guys only offer the Gold Coast Health Plan, or is it any kind of managed care plans?
Well, with Kaiser, us as a plan, we made an arrangement with Kaiser to continue care for members that were formerly Kaiser, and for whatever reason, so they will accept your Medi-Cal if you were formerly Kaiser within the past 12 months.
Oh, okay, because I mean, I did my application the end of January, and I've heard nothing, and now I'm gonna lose coverage tonight, so I'm kind of freaking out, but.
And for individual cases like yours, you can, after our discussion, we can go to the back table and
Oh,
get
that'd be
your
great.
information.
I brought some stuff with me
Okay,
too.
we can help you out.
Okay, thank you.
But we want to get to all the questions, so everybody will get their question answered. Yes, sir.
All right, as time is marching on here, I've already filed my 2013 return. The hub comparison done to 2012 federal return, or can it be down to 2013 return, which is already done?
Yeah, 2013.
Because it's already done.
Yeah. Medi-Cal is based on projected annual income. So Medi-Cal looks forward and it smooths that income, if you will. If you have seasonal work, or you work, at a summer job, or you work, picking, and your income's gonna go up and then it's gonna go down, they will smooth that out, but it looks forward. if you're looking at APTC and those programs, it's going to go back to your most recent tax information.
I'm sorry, Paul, can you explain what APTC is?
Oh, I'm sorry, APTC is Advanced Premium Tax Credit. APTC is Covered California. Sorry, we got so many acronyms that just, they flow out of me. Yes, in the back.
The actual subsidy or whatever is actually going to be based on 2014. They're using the 2013
Yeah, they're using current
2012
income.
as an approximation to try to show income close to what you're projecting. But it's all going to come out in the wash on your 2014 tax return.
I agree, there is a true up. In other words, you report what your income is anticipated to be. If your income is actually higher, then you shouldn't have received as much of a subsidy. You'll have to pay a portion of that, and you will pay that as, when you file your next year's taxes. If your income is actually lower, then you should have received a greater subsidy, and you will receive a refund. So yes, there is kind of this leveling, if you will, that happens with the next year's tax filing. Yes?
What happens if you're on Medicare, and as far as getting Covered California or getting Medi-Cal as the subsidy?
Anybody who's on Medicare can also apply for Medi-Cal, called a Medi-Medi or dual eligible. Whether you're in fact eligible or not, depends upon your specific situation and the rules. I don't think that anybody who was on Medicare would want to apply for Covered California. I know that if you can, fine. Because I knew Medi-Cal you can, but I don't know Medicare. I just know Medi-Cal because we're in California.
So, I'm not sure if I understand. If you are on Medicare, you cannot apply for Covered California.
Correct.
You can only apply for Medi-Cal.
Correct.
As far as the subsidy.
Correct.
Yeah, basically, the Covered California is for the folks that don't have any insurance whatsoever. If you're getting some sort of health coverage through your employer, you can't apply through Covered California for a better plan per se.
So regarding Medicare then as well, if you have Medicare, you were already covered, so you're not going to be penalized if you don't apply for anything by the 31st.
That's correct.
Would you repeat the question or use the microphone, please?
Yeah, she said, so if you have Medicare, you're not going to be penalized in any fashion for not having insurance because you have insurance. Right. It is insurance. Oh, on the wall there?
Is the enrollment period the same for Medi-Cal?
Medi-Cal's, I'm sorry, continuous enrollment for Medi-Cal. Yes?
I am speaking for a 24-year-old college student who was on Medi-Cal. She makes $5,000 a year waitressing. She gets an $8,000 grant. When she put in her taxes, she had to count her grant. She then became ineligible for Medi-Cal.
Okay.
So where does that leave her? I mean, I know she can apply for Covered California, but I'm looking at all the numbers, and she's in San Luis Obispo County. Are the numbers going to be different there than they are on the sheet you gave me?
No, it would be the same. I don't know, all the details of her situation, but I can tell you that as a 24-year-old, if you have insurance through your employer, she's always eligible regardless of her other situation.
Her parents do not, and I'm
Okay,
grandparent.
I'm sorry, yeah.
So
That would have been her
that's
best
a
bet
non-
if
that's
that
a
had,
non-
that would have been a good thing if that had worked out.
And if she is on Medi-Cal, how often do they have to recertify?
Annually, although you're supposed to report any, significant changes in income.
Okay, so she only has to report annually, so whatever she had in 2013 is going to be projected into 2014.
Yeah, well, again, Medi-Cal uses your current anticipated income. So if she says, I have this grant money and I have this waitressing money, and it's just looking like that's what it's gonna be for the next few months, then that's what she reports as her income. That's what Medi-Cal uses for income.
Okay, she doesn't have to keep coming in every 3 months to recertify?
No, annually, but she does need to report, if there's a large change in her income, she needs to report it.
Does inheritance count?
I'm sorry, there's someone in the back who hasn't answered the question yet, and then I'll get to you in the front. Yes, you.
Okay, so I've heard of some situations out there where a person's income would put them in Medi-Cal, and they would say, oh, I don't want to be in Medi-Cal, so I'll just bump up my household income so that I'm not put in Medi-Cal so that I can get Covered California. So let's say they do that, and we're only talking maybe a few $1,000 a year, but just enough to put them into Covered Cal. So then what happens with the auditing process at the end of the year, your year 2014, tax return, and lo and behold, they really only made $12,000. Oops, now what happens?
Yeah, so the best, I mean, I can't say, because now you're talking about things like, you know, IRS and you know, consequences, and, you know, we're just really trying to administer the program. So I can't say with any certainty what would happen, but my expectation, I don't know, but I would expect, I don't believe there's any sort of crosswalking back and forth where they're gonna say, oh, you were truly eligible for Medi-Cal, and this or that happened. To the best of my knowledge. So, yes?
I wanted to go back to the other gentleman's point where you said if you have insurance, you can't apply for ACA. That's what I understood you to say. Suppose someone already has insurance and ACA is a better deal. You're saying they can't quit their existing